All right, let's go now to prominent economist Art Laffer to talk a little bit more about this. And Arthur, let me start by asking about Washington. We just heard in Lizzie's package there about the same old Washington tactics: find an enemy and go to war. It could be the insurers, it could be businesses, it could be the wealthy. Why don't we make the enemy health care costs and go to war against that? I mean, that was the original point here, right?
Yeah, that is the original point. And frankly, what we really want is high-quality service available to all Americans. I mean, and really high quality and access. And that's what everyone wants. And whether it comes about through insurance companies or governments, no one cares. But they don't want it to cost an arm and a leg. And the government program that's being proposed by President Obama would cost an arm and a leg, and it would lead, frankly, to, I think, a disaster in the healthcare industry. And I don't know why they're now attacking the insurance companies. It's their fault. And it's their problem, and it's their bad bill.
Well, what is the main problem? I mean, you recently wrote about the healthcare wedge in the Wall Street Journal and in a paper that you put out earlier this week. What do you think the main problem is with this bill?
Well, the main problem is cost. It's going to cost a lot more, not only than they say it's going to cost, it's going to cost a lot more than anyone thinks it's going to cost, because they're separating the customer from the product. And when you separate the customer from the product, if you walk into a store and can get all you want and not have to pay for it, you don't worry about costs anymore, and costs go sky high. It makes no sense whatsoever, and that's exactly what's happening. They're going to try to make the healthcare industry like the post office or the Department of Motor Vehicles or like public education, to be very frank. Private education is a lot cheaper than public education, and it's a heck of a lot better. You don't want your doctors being part of government employment. I mean, you really don't.
All right, Arthur, we're going to take a quick break, come back and talk a little bit more about this. I also want to talk with you about inflation and about cash for clunkers. If we didn't estimate the costs of that small program, will it be difficult to estimate the costs of such a big health care bill? Stay with us for more from Art Laffer. We are back in 2 minutes here on Bloomberg. All right, we are back with Art Laffer talking about the Obama plan and what he calls the health care wedge. You're saying, Art, basically that the further away consumers are from the price of services they use, the higher the prices are going to go. Don't we already see this in plans provided by businesses? I mean, you know, we here at Bloomberg have a great health care plan, and I sometimes will stop in for an EKG after getting an ice cream.
Well, you know, that's very true. When you don't pay for something, you don't worry about its costs. My ophthalmologist a number of years ago asked me to buy glasses from him, even though they cost a lot more than LensCrafters say, because it was covered by insurance. It didn't affect me at all. And, you know, those types of decisions are done all the time. Scheduling things that shouldn't be done. The consumer has to be the primary safeguard of how much is spent. And over the last 50 years, we have separated the spending from the consumer, from the actual patient. And you can see how healthcare costs have soared. You can see what happens in the Defense Department, the same thing. You can see it in all sorts of agencies where people don't pay the costs, prices go up a lot. It's like me being in a smorgasbord or in a buffet, where if I get something for nothing, I'll way overeat and I'll buy the real expensive stuff because I'm not paying for it.
What do you think are the solutions to this then, Arthur? I mean, my boss always says, don't come to me with a problem unless you have an alternative.
Sure. Well, there are a lot of plans that will put the consumer more in line with purchases than further away. I mean, no one wants to not take care of the poor, the people who can't get access. That's really important. And that, I think, is a transfer payment to those people. But let them control their own spending. They're not dumb. They're not stupid. They know what to do with the money. Give them the money and let them buy the health care as they see fit. That's what you should do. You should also do tort reform. Have you ever seen how much it costs doctors to be insured against liability insurance? It's hugely expensive.
Basically 10 cents. Well, let's talk about that for a second. 10 cents, I think, of every dollar, according to a story I read on Real Clear Markets today, goes to medical malpractice insurance. Why don't we talk about tort reform?
Well, we should. I do in my paper, and I do all the time whenever I get a chance. I mean, it's one of the obvious things that can be done. But this administration doesn't want to go against the trial lawyers. They sort of like the trial lawyers. Another one is authorizing health care professionals, non-doctors, to perform certain medical procedures that they're perfectly capable of doing. So you don't always have to drag the doctor into the process. Now, of course, you want to make sure these guys don't do stuff they shouldn't do, but they can give you a shot. They can do other things like that. There's no reason why we can't authorize healthcare professionals to do some of the things that doctors now do and save a lot of money.
What about a co-op option for healthcare, letting people band together to buy private healthcare insurance rather than having the government offer it to us and rather than going through our employers?
I love it. I think that's wonderful. I think the insurance that you do have should be portable. I do think it should be transferable across states. All of those things makes perfect sense. Anything to save on costs. And no one disagrees with a government program to have insurance for catastrophic events that would completely affect there. But what we're talking about is the generalized health care. And whenever you put the government in charge of this stuff, you can see how they haven't been able to control the costs of Medicare or Medicaid. And now if you put him in control of all health care, you know it's going to be a train wreck. I mean, it really is.
Well, Art, nobody worries about those unfunded liabilities, right? Not a big deal.
I know they don't.
Thank you so much for joining us, Art Laffer, there, Chairman and founder
Matt, thank you.
of Laffer Associates.